So assessing the cranial nerves. So I'm washing my hands, put on my gloves. So this is to prevent the spread of microorganisms. And now I am going to ask for the patient's name. So hi ma'am, may I ask your name?
I'm Josephine.
So I'm Beverly. I'm a nurse. How are you?
I'm good.
So I will be doing an assessment on your cranial nerves today. So first I will prepare the equipments to be used. And also I will put the curtains down and close the door for your privacy and also to lower the rails to prevent any risk of injury. So I am going to start out by assessing the cranial nerve number 1, which is your olfactory nerve. So please sit at your most comfortable sitting position. Okay, so clear your nose by removing any mucus. So, okay, ma'am. So now I am going to occlude one of your nostril, and all you are going to do is to identify the scent that I am holding. So please close your eyes.
Alcohol. Alcohol.
Okay, you can open your eyes now, ma'am. So you have identified the smell. So I do not see any abnormalities indicating anosmia, hyposmia, dysosmia, parosmia, and phantasmia. So everything is normal. So now I am going to proceed on your cranial nerve number 2, the optic nerve. So I am going to test your peripheral vision by doing a confrontational visual field. So please stand in front of me, arm planned away. Okay, so I want you to please cover your right eye and cover my left eye. So now I am going to, so please look at my eyes and not in my fingers. So please tell me how many fingers and the upper,
1,
and the lower,
2,
and the middle.
3.
Okay. So now please do it on the other side. So tell me how many fingers,
1,
lower,
2, 3.
side. Okay. So thank you. So everything is normal. I did not see any abnormalities indicating glaucoma. So now I am going to test for your visual acuity test. So please move right here. So this is we are going to do to check for any in checking the distance vision. So you are positioned 20 feet from the Snellen eye chart. So from the Snellen eye chart, I want you to cover your eyes with the card. Cover your left eye. And on the Snellen eye chart, I want you to read the smallest line that you can read. D, E, F, P, O, T, E, C. Okay, then do it on the other side, on the right eye. So I want you to read the smallest line that you can read. D, E, F, P, O, T, E, C. Okay, thank you. You may now take your seat. So with your left eye, you have read line number 8, which is 20/20 in vision. So that corresponds a normal visual acuity. And also on your right eye, you have read line number 8, which is 20/20 in vision. So that corresponds a normal visual acuity. So it is important to note the numerator and denominator in getting the visual acuity test, because the numerator indicates your position from the Snellen eye chart, while the denominator indicates the patient's position on the the patient's normal vision, or how he or she can read from the Snellen eye chart. So I did not see any abnormalities like increase in denominator, which causes for patients poor vision. And also, I did not see any abnormalities indicating astigmatism or hyperopia. So now I am going to test your cranial nerve number 3, which is your oculomotor nerve. So we are going to check your ocular movement, and then I am going to have you follow the pen. So keeping your head still, and I am going to have the pen move to the 6th cardinal position of gaze, so that follow with your eyes. So upper right, middle right, lower right, lower left, middle left, and upper left. Okay. So the eye should move symmetrically, and I see that your eyes move symmetrically out of the pen. So conjugate movement, meaning that your eyes are moving togetherly nice and smoothly and normal. So now I am going to look at the pupils of your eyes. So look straight at me as I am going to shine a light on your eyes. So I'm going to light your pupil. So let's just assume that this is a pen light. Okay. So I see that your pupils are constricting. And I also look at the pupils at rest. They are equal in size and round, and your irises are brown and equal and round. So I would document it as perla or the pupil equal, round, and reactive to light and accommodation. So now we are going to test for the accommodation. So I will put my finger 4 inch from your nose. So look at my fingers. Then look at the wall behind me. And now look at my finger again. So I see that your pupil constricts when you focus on my finger. So that's testing the cranial nerve number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens nerve. So now let us proceed to the cranial nerve number 5, which is your trigeminal nerve. So to test the motor function, please clench your teeth as I palpate your temporal and masseter muscles for contraction. Then now open your mouth for resistance. Okay, thank you. So everything is normal. So now I am going to test for your facial nerves. So close your eyes tightly. Open your eyes. Smile. Frown. And puff out your cheeks. Okay, thank you. So it is symmetrical over your contour, your lines, and your wrinkles. And the facial movement is also symmetrical. So now is for the vestibulocochlear nerve. So to do the whispered voice test, which is your cranial nerve number 8. So I'm gonna say something and you're going to repeat it while I'm gonna occlude one side of your ears. So please close your eyes. Black shirt. White shirt. Okay, thank you. Open your eyes. So everything is normal. So now I am going to inspect for your glossopharyngeal nerve. So to test the motor function, open your mouth wide and say ah. Okay, thank you. So ovula and soft palate is rise bilaterally and symmetrically on phonation. So everything is normal. So now we are going to test your gum reflex. So this is a bit uncomfortable. So I am going to touch for the procedure pharynx with a tongue depressor. So let's assume that this is a tongue depressor. So open your mouth. Okay. So I see that I see that it is intact, and I do not see any indication of dysphagia, so everything is normal. So now I am going to check your abilities to swallow. So drink the water. Okay, thank you. Then also, I did not see any difficulty on your swallowing. I did not see any or note of hoarseness. So noted that everything is normal. So now I am going to proceed on the sensory, on your spinal accessory. So please move your head side, another side, up, and down. So the range of motion is normal. So now you are going to shrug your shoulders. So shrug your shoulder up and shrug your shoulder out against my hand. Okay, so relax. Okay, so it is symmetrical and everything is normal. So now for your hypoglossal, to assess the mobility of the tongue, open your mouth. Now protrude your tongue. Move it side to side. Then open your mouth. So please close your mouth. So everything is normal, and I didn't see any abnormalities. So I'm gonna put the rails up for any risk of injury and do an aftercare for the equipments that have been used. Now I'm also gonna wash my hands and remove the gloves to prevent any spread of microorganisms. And also I am going to document the findings and record it on the patient's chart. So that concludes our assessment on cranial nerves. So thank you so much.